Good afternoon, everyone, and thank you very much for joining this live Supreme Fertility broadcast this afternoon. Fridays, everybody's busy, but it's probably a good time just to take a bit of time off and learn a little bit more about your reproductive health. I'm excited to be joined by two very dedicated and passionate dietitians this afternoon from the Linmed Dietician group, and Cassie, Coutsides, and Kelly Smith. So thank you very much for joining me this afternoon. To both of you, I know you've got extremely hectic schedules, so I really appreciate your time just sharing a little bit more information with our Supreme Fertility listeners out there.
It's a pleasure.
Thank you so much. So if you can just give us a little bit of background about the Linmed Dietician group, where you guys are situated, etc. I'd appreciate that, please.
Okay, so we are based at the Linmed Hospital in Benoni. I've been working there since 2015, and then Kelly joined the practice in 2019. We mostly deal with medical conditions, so things like diabetes, PCOS, gut-related issues. And yeah, I think that's pretty much it.
And I know one of your services that you have recently added is the Supreme Fertility Program. So you are a little bit passionate about helping couples have babies and treating PCOS, etc. So how did this passion for fertility come about?
Well, for both of us, I think there is a personal bit to it. From my side, I think it was back in 2017, I was diagnosed with fibroids, and I think it just made me aware of how sort of common these issues are. So I took it on myself to try and be as healthy as possible. And then I find it's always good to practice what you preach. So at least I know I can say I've tried and done these things to hopefully help our clients in the future.
That is a great way of doing it. And yourself, Kelly?
So from our side, I also was diagnosed with PCOS or PCOS when I was about 16. And my mom also struggled to conceive, and she had endometriosis. So it's also something close to me personally. And as Cassie says, I think it helps when you know what your patients are going through and you can relate to them.
No, absolutely, because it makes it so much easier to treat when you know what they're going through and what symptoms they are experiencing and what works for you as well. Now, there are so many different factors that can affect fertility that we really address, but one of the common issues that we do come across is problems with menstrual irregularities. And if the two of you wouldn't mind just mentioning or discussing a little bit what types of these menstrual irregularities can occur, because I think some of our patients might not even be aware of what could potentially go wrong with their monthly menstruation.
Yes. So to mention a few, we get menorrhagia and polymenorrhea, which is prolonged heavy bleeding. And then a person can get dysmenorrhea, which is excessive pain during menstruation. Person might get amenorrhea, which is the absence of your period, or even hypomenorrhea, so a really extra light period. But obviously these things also are situation dependent. So if you are concerned, we always advise that you consult a medical professional. And it's most things are, we can help you with, but you just need to consult with someone.
Yeah, sometimes I think people don't even know that there is anything wrong with their menstruation, and they just assume that it's normal. So sometimes if they are a little bit suspect that things might not be 100% right, it's always good just to ask somebody for a second opinion as well, because it's not normal not to have a period like every month, or to have excessive bleeding, or even super tiny bits of bleeding as well. So it's also not like normal. But I know a lot of our listeners don't even really know what menstruation and ovulation actually is. Could you maybe just in a quick, like layman's terms, maybe just explain to them what actually happens in the woman's body every month?
Okay, so ovulation is when the ovary makes an egg. That's what happens. And then that should happen every month. When the egg is not fertilized by sperm, then the lining of the uterus gets shed through the vagina, and then that is menstruation. So that is the bleeding that somebody would see on a monthly basis.
Okay, so that's thanks for sharing that, Cassie. And if these things go wrong that you mentioned, if they are bleeding too heavily or too light, or if the period has disappeared altogether, what potential causes could they watch out for, or what could be potential causes that can cause this to happen?
Okay, so again, there's many possibilities or causes, but to mention a few, and especially sort of related to do with Cassie and I, poor diets and nutrition is one. Anemia, so if a patient is deficient in iron or vitamin B12, excessive caffeine intake, so coffee lovers, it's a possibility, poorly controlled diabetes, excessive stress or excessive exercise, and then also rapid weight gain or extreme weight gain and extreme weight loss. And that is also linked with eating disorders and so on. And then polycystic ovarian syndrome is also one of the causes of missing periods or having irregular periods.
Yeah, and there are so many different things, and that's what we like doing at Supreme Fertility as well, because patients don't really know what to be mindful of and what to watch out and be careful of. And everybody knows that diet's so important, but nobody really knows what an important role this has to play. And people always say to me, I'm not eating meat and I'm not eating sugar. And I always will remind them, it's not so much about what you're not eating. You've got to be getting all the right nutrition into your system every day to ensure that the reproductive system is healthy, and that's for both men and women. And men are often more guilty of this because they always just think it's a woman's job to eat correctly and take supplements, but it's absolutely not so. And I think one of the concerns that a lot of people might have out there is they do go for a month without having a period. Do we classify them as being infertile then, or not necessarily so? Or
if it's a once-off thing, it doesn't necessarily mean that. But if it's something that there's a continuing irregularity, whether it's missing it or very heavy bleeding, then that, yes, might be a cause for concern. And then you should definitely seek some professional advice. Always try and sort out the problem sooner rather than later.
Yeah, particularly because you're not supposed to miss a period at all. So it's not normal. And just one of the common things that we see and deal a lot of, I know you guys, but what I see as well in the Supreme Fertility office as well, is people struggling with PCOS. Now, that's polycystic ovarian syndrome for people that don't know anything about it. And one of the primary symptoms or causes that can happen with patients struggling with PCOS is these missing periods. Just maybe if you can touch a little bit on that, and how does that affect ovulation, and is it something that's treatable?
Yes, so with polycystic ovarian syndrome, it causes an imbalance in hormones, particularly our androgen hormones, and that interferes with the growth and release of an egg. So obviously, if we don't have an egg that's been released available for a sperm to fertilize it, one can't fall pregnant. But it's not to say that you can't fall pregnant with polycystic ovarian syndrome. You can ovulate if you have polycystic ovarian syndrome. It's just about getting the correct management, treatments, improving lifestyle, diets, medications if necessary. So it's definitely not that you can't fall pregnant, but if it's not managed, it can affect your ability to fall pregnant.
And I know a lot of people, when they're recently diagnosed with PCOS, it's like such an emotional thing. I've actually seen girls quite teary about it. And they say, I'm never going to be able to have children. I've got PCOS and it's like so bad. But the good news is it's actually one of the easier things for us to treat, like on the Supreme Fertility programs. And I know one of the critical areas that we do focus on is nutrition. And that's your area of expertise. So are there any tips when it comes to diet and nutrition and lifestyle that you can give out there to people who are struggling a bit with PCOS or missed periods for that matter as well? What would you recommend?
Well, in sort of general terms, I would definitely recommend a diet that's very rich in whole grains. So things like brown rice, as an example, lentils, obviously that's high in vegetables and fruits, and a diet that's low in total fat, and specifically looking at saturated fat, so fats we get from like on chicken skin and fat on meat and coconut, and trans fats, which are fats that we find a lot in sort of very processed foods, things like takeaways, fried things, just as an example. Obviously, maintaining a good body weight is also important, and a good body fat percentage is also important. And the reason why I say that is because sometimes we can be of a good weight but not necessarily have a good body fat percentage. So that's also important. There has been a lot of research into supplements, things like magnesium, chromium, selenium, vitamin D, and omega-3. But this is definitely not a one-size-fits-all sort of, you don't just sort of now go and buy omega-3 and take as much as you want or what you think is appropriate. And that's where we would encourage people to come and seek help, especially from a dietitian, and to do something like the Supreme Fertility genetic test, so that we can, as well as blood tests, also can help us to determine this, so that we can tell you exactly which things you might be lacking and exactly how much to take. And that's the whole thing behind this personalized nutrition. The other thing, which I just want to briefly mention, is that it's a very common myth that everybody with PCOS must avoid gluten and dairy, which is not always the case if you have a proven intolerance. And it's also something that these genetic tests do look at as well, is the gluten sensitivity. And from there, we can determine. So don't just go and do it because your neighbor is doing it. It's really should be something that's personalized.
Yeah, no, thank you for sharing that. But what's really difficult when it comes to changing diet as well. It's not easy to change your eating habits, because people are so used to the way they eat and how they eat. And I like to think sometimes we do need a little bit of guidance and an accountability person that's just walking the road with us. So as part of the Supreme Fertility Program, how do you guys actually use it? How does it actually work when you're treating a patient with PCOS, for instance? How would you approach it, and how would you use the system? And is it possible that the Supreme Fertility Program works for something like PCOS as well?
Yes, absolutely. So when we look at Supreme Fertility, it tests a lot of the genes that are related to PCOS. So our TNF alpha, AdipoQ, CYP1B1, CYP17A, interleukin 6. So yeah, those are all big words. And obviously when you come and consult with us, we go through in depth, what the genes are, where they work, and how they are affecting your polycystic ovarian syndrome. And yeah, the test then gives you feedback in terms of what to focus on with diet, and it highlights, and lifestyle and all of those things as well. But it highlights red genes, which are high risk and things that we really want to focus on quite a lot. And then yellow and orange genes, which are also moderate risk and things that we must be aware of, and green genes, which are lower risk. So yeah, it's not a one consult thing. So it requires constant sort of follow-up and feedback, as you say, to maintain motivation, and also just to have someone walking the journey with you. But there's a lot involved. It's not just one thing. There's a few things. So that's why, regular follow-ups help us to go through each thing. And as you say, it's not easy to change diet. So we can say, okay, try this. This would help this gene. But you might come back in a month and say, I'm really struggling to include more green vegetables, or I don't like green vegetables. And we can assist in how can one include more green vegetables, give recipe ideas, those types of things. So yeah, and that's what's quite nice about the test as well, along with our nutrition knowledge and things like that. It also suggests lifestyle suggestions, so it gives some recommendations to do with exercise, supplementation that you may benefit from according to your genes. So you possibly need the Supreme Fertility folate with the myo-inositol. Looking at environmental factors, so maybe you don't do well with toxins that are in your environment, and you need to look at cleaning up your environment. So it really is it's a holistic approach. We don't just go with diet, but obviously that is our field of expertise, and we try to guide you and walk along the journey with you as far as possible.
No, thanks, Kelly. And just from my point of view as a pharmacist, that I always like to remind people, they just think that vitamins and minerals are safe because they're natural alternatives out there. But people forget that vitamins and minerals also can have side effects. And it's so important to walk this path with a healthcare practitioner that is measuring certain biomarkers in your blood and blood work, etc. And because we really do want to find those biomarkers so that these dietary and lifestyle changes that you are recommending and the supplementation that you're putting the patients onto, is it actually working? And it's so important that they keep coming back to you, that you can test If somebody's struggling with PCOS, that's a hormonal balance problem. And what a lot of people also don't understand is that hormone balance, diet is such an important role to play in balancing those hormones. And there's a lot of important foods. You have a lot more experiencing this than me, but I know things like your cruciferous vegetables, some mushrooms, quercetin, and things like that, even licorice for that matter, can actually block certain key enzymes in your body and help to balance your hormones. If you focus on that 100% with some key plug-in supplements and stuff, you can definitely help to bring those hormones and stuff into balance. So I know some of our listeners out there might be in your neck of the woods, and if they'd like to pop in and have a Supreme Fertility program done with you, some DNA testing, or even if they need help with some PCOS treatments, how can they reach you? Where will they be able to get hold of you and find you? So if you could please just share your contact information and how they can reach you.
So I think the best way to try and get hold of us is via our cell phone number. So you can either WhatsApp, phone us, or send us an SMS. And the number is 060-5678-748. And yes, you can send us a WhatsApp if that's easiest for you. Phone, if we don't answer, we will phone you back. It's not that we're ignoring you. We might be busy with the consultation. So yeah, I think that's the best way to try and get hold of us. And I just to touch on what you said, Debbie, it's about, people sort of think that there's very surface level. When people Google things, it's very surface level information. And like something, I will say I myself have done the Supreme Fertility genetic tests, and I used to use a energy booster regularly that had, what was it? Did I say ginkgo in it? And then I read oh my gosh, I shouldn't be using this because it, I think, affects the egg quality or something like that. So it just shows you that there's so much more than just I'm not eating chocolate, I'm not drinking Coke. And that's where us and these tests come in, is that it really dives deep. That's especially in people that maybe have not had success falling pregnant or not had success with IVF. We can help to maybe find that very small little piece that is just not falling into place, so that you don't have to keep on going through this very emotional journey of not being successful. At least we can do this way. Obviously there are a lot of things that play a role, but the more boxes you can tick off and know that they are right, then the better chances you have of success with pregnancy in the future.
No, absolutely. And I know we mentioned briefly about PCOS and hormonal balance, but one of the other major symptoms of PCOS is this weight gain and this obesity that people struggle with. And I think that's another really important aspect where dietitians are critical, because for a healthy reproductive system, we've got to get the weight back into a healthy balance, because it can affect fertility in so many different ways, and even miscarriages and egg and sperm quality and all sorts of, and the ovulation that we miss. The ovulation can just disappear completely, and you won't be able to fall pregnant if you're not ovulating. So there is just so many areas that these patients do need help with before they actually even want to go for a conventional treatment, because sometimes it's not going to work if you don't get these basics back working properly as well. So Cassie, if you wouldn't mind just sharing that WhatsApp cell phone number again, if anybody did miss it.
Okay, it's 060-5678-748.
No, fantastic. So I'm going to just wrap it up. I know everybody's busy and you've probably got a whole lot of patients waiting for you in the waiting room. But thank you so much for joining us and just giving us a little bit more information about what ovulation and menstruation all is, and how it all links together with PCOS and fertility treatments, etc. I'm sure there might be one or two patients that might have any questions for you. Please just do WhatsApp me directly or email me directly, and I'll forward the questions to Cassie or Kelly, and I'm sure they will happily answer them and reach them. Or if you missed the WhatsApp numbers or their web contact details, etc., please just drop Supreme Fertility a line and we'll put you in touch with them as well. So thanks again for joining us this afternoon, and don't forget to join us for our next Supreme Fertility Live.
Thanks,
thank
Debbie.
you.